guys, it's Rapunzel here, and I am here with a little update for everybody concerning my recent pulmonary valve replacement. And I did actually get a transplant, which was, I don't know if I've had a human graft before. But I did get a human graft this time. I'm still not exactly sure who the donor was. I did reach out to the company that handles the donations and things like that, and to see if I could possibly get in contact with the family of the donor. I do know the donor was a 37-year-old female from Florida, but that's about it. But I did write a long letter to the family. And I haven't gotten a response yet. I don't know if they've gotten the email yet or not, but that's a topic for another video. Basically, I'm here today to tell you about how I've been doing since my surgery, and what could possibly be in store for me for the next couple weeks or so. So basically, the surgery went well. I do plan on making a video about kind of the surgery itself and the aftermath of it, guess the days after the surgery, because I do have some pictures and videos from the week after my surgery, which I want to put into a video. But for now, the surgery went well. The recovery afterward was really great. They weren't sure if I was gonna be able to go home without oxygen and a walker at first, but within a few days after that, I was able to get off the oxygen and walk off of the walker by myself. So that was good. So I ended up not needing to do that, thankfully. And then just, I've been doing pain management and things like that. Things went good. My post-op appointments went well. Everything was looking good. Fluid was, pretty much gone from my body that was retained, which is good as well. But in the past week or so, things have changed from that. It started off with just like a minor fever, around 99, and I've kind of had it on and off throughout the week. I mean, usually at some point during the day, I have a slight fever of 99 or over. But it's not like a constant, fever. It's just like it happens like for maybe like an hour or two at a time. I mean, it's random, basically. It's random. And then I've been having some flu-like symptoms, especially today. Things like nausea, cramping, chills, diarrhea, all those beautiful things that you get when you have the flu. And right now I actually have like a killer migraine, which is lovely. I don't even know why I'm sitting here. Um, but yeah, so that was a little worrisome. I've had some palpitations, a couple times. But I've been in touch with the on-call nurse pretty much all week. Whenever something comes up that I'm worried about. And she just kind of said to keep an eye on it. And then today, after I had like a really bad, like, nausea, cramping attack, I ended up calling again. And basically, they were concerned that since it hadn't really gone away throughout the week, it kind of just stayed consistent. That something might be going on. Obviously, the first thing that they would be concerned about would be rejection, um, transplant rejection, which basically would mean that my body thinks that the my valve that we've replaced is a foreign object, which it basically is, but that it's not supposed to be there and that it needs to be destroyed, which would be a terrible thing to happen. Obviously, it's very dangerous, and could possibly lead to infection, sepsis, having to have it completely replaced again, just a whole list of nightmarish things, um, which, right now is not really that apparent that I have anything like that going on. It's more just kind of a cautionary thing. So I'm gonna be hopefully getting in tomorrow to see the surgeon and probably gonna get some blood work done. Things like that. I'm hoping nothing's wrong. I'm hoping it's just like, a bug, a virus, But because it's so recent after my surgery, um, they have to do, testing to make sure everything's okay. Um, so I figured I would make a video about that because one, I said I would update you guys on how I was doing, and two, I don't know what the next few days hold. I don't know if it's going to be, a problem and I'm going to be hospitalized or if it's just going to be fine. I don't want anything to sneak up and surprise you guys. Yeah, I figured I would just like make a little video telling you, give you guys a heads up that there could possibly be something going on. But obviously hoping not. Hoping everything's fine. But yeah, just kind of, yeah, that's about it, really. Other than that, I've been doing pretty good. The pain's been better. It's not like completely gone yet, obviously. And it has been getting a little bit worse in the past week, which is another thing to be worried about. But everything else, the incisions are looking great. You can see like there's just like this one little spot here, but like you can barely even tell like that there was a recent like surgery there. Like it's just like, yeah, it's barely noticeable. And then my chest tube sites are closing up really well. So yeah, everything else looks great. So that's really good. So yeah, that's pretty much it. I will let you know if I can, if anything comes out of tomorrow or not. So yeah. In the meantime, uh, that's about it. So thanks for watching, and I'll see you guys next time.